Hey, and welcome to today's interview, in which I will talk to Professor Dr. Dirk Revenstorf. He's a rewarded German psychologist with education in Gestalt, Hypno, couple, and body and behavioral therapy. Also, he is the author of 20 books and 200 articles, many of them about clinical hypnosis. In our conversation today, we will talk about clinical hypnosis, about his definition of mental health, mental well-being, about the typical struggles many artists have in their life and careers, and also about the use and abuse of psychedelics. Yeah, welcome, Dirk, to this interview today, to our conversation, where we will talk about mental health, about hypnotherapy, about art, and how all these things also related for you in your life. And I'm wondering what kind of role art plays in your life today.
Yeah, interesting question. Much time of my life is occupied or is concerned with art. So I hear music, I hear jazz, I hear pop, any sort of pop. I play music at least half an hour per day, saxophone. I just finished it. And also, because then I center myself and beyond the rational problem solving and the daily stress and hassle. Also, I love exhibitions. I mean, arts and sculpture, and visit it every time where I meet it. I like poems, and I write poems. And although that's not art, I mean, I doubt that it could be called art, what I'm writing in poems. But also, I'm reading novels a lot. And we read novels together with my wife, loud every night, but also for myself. And I love opera. I love opera, all the scenery and the music and the decoration and the Baroque atmosphere. So as long and as far as I can, get in contact with art of any kind, I would like to consume it. I'd like to meet it and live it.
Nice. So, from you could say from all sides, you immerse yourself into art, from like a consumer side,
Yeah.
doing side, from also from a creation side, when you for example read poems or literature.
Yes.
Nice. So it plays a really big role in your life, and another big role in your life is therapy and hypnotherapy, right?
Right. Yeah. And talking to people about their lives and their troubles and their pains is like diving into a novel which opens up in front of you, this life of this patient. And to a certain extent, the therapy is like developing this novel, which seems to be confused and diffuse and unclear when the patient comes. And the joint experience, the joint endeavor is, to evolve the road which goes this life and make it meaningful. Although, it's more meaningful after doing therapy with somebody, because then the whole thing has an ending and a beginning and some turns. Although sometimes painful, it's much more meaningful than before. And seeing this, all the failures and the sufferings, you can discover that this life, although it's kind of scrambled up sometimes, it's always an endeavor to development. So what you do with your patient is to see and to underline the points and work on the points which make visible that your life is a development and there's a next step which you may have been overlooked, but now you can get it and you can have a breakthrough and go there and take the next step. So, and also, my Gestalt teacher, Prof, always said, everybody's life is worth a novel. You could write a novel from every patient if you want to.
Yeah, true. Beautiful.
And then, you talked about hypnosis. Hypnosis is special. Hypnosis, in hypnosis, you have a different kind of communication, and you use metaphors and symbols much more than in usual everyday talk. And to some degree, this use of metaphors and stories and symbols in the communication with the patient is to some degree poetic. It's the same true for images and dreams, And so, because hypnotic communication is free of the restrictions you usually have, to be stringently rational thinking in every day. And dreams and hypnosis are states where you kind of let go, you let leave behind, and you just you go into the stream of consciousness with all the associations and images which occur, and in this way enrich the structure of the concept of the problem as a patient sees, and you leave behind the boundaries of everyday reasoning. And then, in this way, the semantic space, by these metaphors and by this indirect and open communication in hypnosis, and also the open state in which the person can receive these messages, by this different way of talking to the patient over his problem, over his life, you open up the semantic space which enriches his concept and broadens his ideas of life and his own life, and the possibilities which make possible a revision of his narrow conceptions, his narrow images of himself, his life, and his behavior. Maybe give an example,
that's good.
To make this thinking more vivid. That's a lady spent hours and hours per day on her iPad. Everybody knows this kind of problem, more or less. During hours, and even in vacation, during vacation, she stayed in the hotel room instead of going to the beach. So she just couldn't stop. She just couldn't, she wanted to abstain so dearly, but she didn't manage. So in hypnosis, she was told that the iPad will become totally unattractive, totally indifferent after half an hour. And then she would let go. That was his hypnotic suggestion. But the interesting part was that when I told her a fairy tale, about Snow White. And Snow White, Snow White eats the apple and then almost dies. And telling this Snow White metaphor, she came back and said, "Oh, that was very interesting because, my iPad is an apple. And I know it became aware to me. I became aware that the iPad has a sweet and a poisoned side also, like the apple in Snow White. And so you need to bite in the sweet side of the apple and not in the toxic side. So maybe, maybe half an hour of iPad is just the sweet side of the apple, and the rest you can turn away and don't bite into the toxic side." So this apple from the fairy tale made clear to her that her iPad is also a good thing, but also has these toxic aspects which she can avoid. And that in the fairy tale, Snow White almost dies from it, but she was saved, and now she knows which side of the apple is okay.
Nice. So you kind of utilized this fairy tale into hypnosis to help her to see this point for herself.
Yeah, kind of to enlarge the context in a different space, the fairy tale space, and another time, another location, and then the mind opens up and connects somehow, and then sees everything is connected, and in this specific way, she could see even the other side of the apple.
Yeah. Interesting. I guess like using a fairy tale also makes it easier to not trigger the defense mechanisms of like, that's not me and that doesn't belong to me. And
Yeah, true.
very
And because, fairy tales, I'm not speaking to you. I'm just talking about, Snow White, and you're not concerned actually. But your unconscious is still listening and sees what he wants to see and can leave out what he not wants to see. And so it's also, if you tell a metaphor, if in the minute or in the moment you begin to tell something, the people, the patient, the guy, or the guy who listens regresses to a kind of childlike state, which is more open and more easy to relearn and more efficient in learning, in general. So telling stories and combined with hypnotic state of hypnosis, the trance state of hypnosis, the reception is different and is more efficient and maybe easier for a change.
Can you explain like shortly why this is, why we are more open and more flexible, so to speak, in the States?
It has been long, for much time, for a long time, it had been a secret. What is the secret why in hypnosis and hypnotic trance people are able to do things which they don't believe they would be able to do? And like bad habits, or like all kinds of stuff you would think you would never like to do it, and would you never do it? And the point is that in the cerebral mechanism which regulates your everyday thinking, there are two important aspects. One is your self-reflection. You always think on yourself and think, does this fit my concept of myself? When I think this or when I do this, is it okay for me in the way I think? I thought all the time, is it okay? What will the people think? Does it give a good image for myself? So these self-reflections, which always tend to criticize your own position, sometimes, they reinforce it, but mostly criticize it and restrict it. This part of the brain is turned down, is deactivated. So don't think about, is this me? Does it fit for my, usual history, what I've been before? You just receive it and, work it. And the other part, which is also deactivated, is the reason, the part of the brain, the frontal brain, which has to do with reason and thinking and criticize and analysis, and which uses categories which are mostly very useful, for everyday business. But if you got stuck, in some problem, then you need a different way of thinking, which is more creative, more open, and does things which are kind of unreasonable, more fantastic. But after a while, you see, like in the fairy tale, it has something to do with my problem, and I can enlarge my meaning. So that's why it's worthwhile to use hypnosis, hypnotic trance, to get into the state where the patient is open, and you, in your language, also in your style of communication, transmit information in a metaphoric sense, which has many options, has many meanings, and the person listening to it can pick the one which is right for her right now.
Awesome. So if I would sum up what we talked about until now, I would say that hypnosis is the tool and a way to guide people into trance by using words, by using language, using suggestions. And in this trance state, the inner critic, so to speak, gets more quiet. And through that, or even like is completely silent. And through that, people are very open and receptive to hear new things for themselves, to have new insights that can be triggered or like generated from the words that the therapist is using, for example, through metaphors or through fairy tales or through stories that are very open and gentle in a way.
Yeah.
I get that right?
That's true, yeah. Well, there are 2 points actually. One point is that if the patient gets into a hypnotic state, which not everybody can or not easily can, then he leaves behind his self-critical attitude, and he leaves behind his everyday reason, and just is open like a child fantasy way of thinking on life. And also because the patient is listening to a large part, he also regresses, or he also turns back into a childlike state, which is willing to see what the therapist has to say to him and not to oppose him, because my reason would say it's otherwise. So it's more open, it's more fantasy prone, and it's more fluid.
Yeah.
And the usual connectivity, the usual connections between seeing a problem and looking for the immediate solution word is disconnected. It's just I see the problem, aha, and then I hear fairy tale, aha, this is a fairy tale, it's a different time, but maybe there's something which can connect in a new way. So it's disconnected, and then new connection can be found.
Nice. And I just had to think about that. For me, that sounds very related to a creative process where, in how I would describe it, we also sometimes hit a wall with our intellect.
Yeah.
And then when we know how to let go and like let our intellect rest,
Yeah.
the answer reveals itself to us by itself. It just comes to us, and we have like an insight and know, we can do this here, or maybe use this color here, or do this chords and this melody here, and then we can go back into this flow state, which for me is also a trance state.
Yeah, try. That's true. Yeah, that's true. In a way, I think the way artists think, musicians and painters and others, poets, is very close to what the way patients think in hypnotic trance, because they connect things which are kind of surprising. Like if you read poems, there are many surprising turns. Look, why does he use this word? For instance, if the poet says, "My poem is my knife," then you wonder, what does that to do? Poem was knife. Knife is aggressive.
Yeah.
But actually, you can see, well, the poet maybe have a political intention with this poem to accuse somebody, to accuse some government, for instance. But he puts it in a poem, so the poem is nice, but still it's a weapon,
Yeah.
So the poem, and this is again a poem, my poem is my knife, is a way of reconnecting things which are not connected so far, and then makes a new meaning.
It's like a free association.
Yes, right. Yeah. Fluent.
Since like the overall topic of our conversation today is like under the umbrella of mental health for artists, I would wonder how you define mental health or mental well-being for yourself.
Mental health or mental well-being to me means to be in contact. I mean, in contact with myself, but also with the world, and the world contains human beings. So well-being, mental well-being, has much to do with feeling in contact with other things, with the table, for instance, but also with your work, but also with yourself, with your body. And just my favorite way to get in contact with my body is either to meditate or to run or exercise, or make kiting maybe, or even sex is or eating. It's all or cooking are things which you are ways to connect with your senses and then feel yourself as an alive being.
Yeah.
And the other point is getting in contact or stay in contact with the people, with the people you're connected with you like to speak to and have time together. So, talking to them, writing to them, seeing movies with them, discussing. So we have, we meet people on Zoom right now, but, we look at movies at the same time and then we discuss the movie. So we stay in contact with the people and meet them and discuss them about politics and everything and philosophy. So these 2 points, stay in contact with yourself and stay in contact with your environment and not get lost in your mind.
Mm-hmm. So not getting lost in your mind. Can you talk a little bit more about that?
Yeah, right. Also, in Gestalt therapy, again, they say, lose your mind and come to your senses, because the senses, your senses connect you with a thing which happens at the moment and right now, and life also takes place in the moment, doesn't take place in the future, doesn't take place in the past. You live if you are present in your moment right now, and for that you need your senses. But your mind is wandering, and a wandering mind is kind of difficult because it wanders in the past. What did you wrong? What was good, and what will never come again? And wanders in the future. What hazards will come, and what problems and pains will come, and how will I die, and so mainly to be in your body, in the presence, means not to think too much about past and future in the first place.
Mm-hmm. So being present despite of your past and your future and despite of the challenges you experience right now.
There is an exception. I mean, you can't, sometimes you have to think on the past, just to recover some memories which are important. And sometimes you have to think on the future too, because you have an insurance yet, for some
that's
case.
Too.
And also, one thing is interesting, because one thing in the future is very important for your well-being, that you be aware of your dying. Because, when you think you don't die, you're really not connected to life, because only in the moment that you think, well, this life will end, you see what life is. And, the Romans always said, think on dying and enjoy living.
Yeah.
And you enjoy living much more if you know you will die. So dying is not so much a threat. Dying is much more kind of an advice, to live.
Yeah. When you speak of Romans, I think the Stoics, Marcus Aurelius, they had a saying around that.
Right. Memento mori, no?
Come again?
Memento mori.
Yeah.
Exact, yeah.
Or that death is it's not a punishment, it's actually a gift.
To die.
Yeah, because it makes life more meaningful.
Yeah, the knowledge of it, yeah, it's true. Mm-hmm.
I really like that. It reminds me again how important perspective is, because you can see death as something really threatening, or as something that gives you power and energy.
True, yeah.
And there's a book from a woman who worked many years as I think the English word is palliative nurse. So she
accompanied people dying.
Exactly, yeah.
Yeah.
And she heard for herself that these people regretted the same things that they did or did not in their lives.
Yeah.
And she said, actually, they always said 5 things, and let me see if I get them together. The one thing was, I'm regretting that I haven't lived the life true to myself, but true to others.
Mm-hmm.
I regret having worked so hard or so much, or
Yeah.
not have worked less. I regret not having spent more time with my family and my loved ones.
Mm-hmm.
And the fifth, I can't remember right now, but I will link to this book in the show notes. And
Yeah.
I think when I read it, I thought it was really powerful because it reminded me that it's also important to think about how do I want to live, and
Yeah.
what a question that I liked was, what of the things I want to be remembered for haven't I done yet?
Good. Yeah. Yeah. You're talking about Bronnie Ware, and in her book, she also mentioned one point which is interesting. The fifth point you you just missed. He said it's so important, or the people regret it not to have done it. It's so important to step out of the comfort zone where you're always safe. We're always safe. We have our income, we have our house, our family, and we stay with that, so we're safe. But it's so important to step out of that and do something which is unpredictable in its outcome. But do some travel which you don't know where you land up, or do some enterprise or something which is risky. But then you find creative new solutions, and you feel yourself living because you're not in a routine and got stuck in a routine.
True. Yeah, and I did this a lot of times, and what I found is that I always found the solution in exactly the right time.
Yeah, right, exactly.
Nowadays, I trust on this, and that
Hmm.
was really life changing.
Yeah, yeah, that's true. I mean, so you can't just do away with the past and the future. And for instance, if you think on the past, it's very healthy to think about what can you be thankful for.
Yeah,
What good things happened to you, and which you be grateful to have lived that way. And so that's important for the past to make you happy, to make you content. And for the future, you've just you have in yourself the hope that will something fantastic will develop more or less soon. And with this hope and this gratefulness, these 2 points together with your presence in the present, um, it's a good combination.
absolutely. And for me, I would say that the third ingredient, so to speak, is to know that you will be okay no matter what happens, because you're okay
Yeah.
not at stake.
Well, that's sometimes difficult. Well, sometimes you have some doubts whether you're really okay and you shouldn't have done something different. But, in general, you should, trust in yourself. Yeah,
Hmm,
true.
absolutely. And what advice would you give to an artist who is like struggling with his mental well-being right now?
Yeah, it's a little difficult because, art is something not normal. I mean, so normal categories of thinking and living do not apply to art. And so artists live an extraordinary life usually, sometimes without money for a long time, and sometimes, without being able to be creative and just boring. So an artist has to develop his own style. And, some artists are very disciplined and they wake up in the morning, 5 o'clock in the morning, and they work 5 hours, and then they leave it, and then they be with the family, for instance, or do something different. And some artists are right kind of lunatic. They work until they just break down. So they work for weeks and then have a breakdown and then do nothing, or maybe they get drunk and use drugs. And so everybody who is creative has his own way to maintain a state in which he can be creative. And it's hard to give some general advice what is the right way for a creative artist to live. The only thing is maybe, there's some things which should be avoided, in every case, in any case. and get addicted to some drug or get addicted to some toxic medication, just to get some relief of all the burden which you carry, and all the problems you carry with yourself, and all the emptiness maybe also. As an artist, the greatest pain is the emptiness, because you see white paper and you can't write down anything because nothing comes to your mind. So there is no general advice. Maybe there's a little warning: be aware or stay aware that you can easily slide into some addiction of some kind, to cover up being with the emptiness after the work.
I can see that point. And I think it's also possible to learn and establish healthy ways how to deal with this. As I think it's possible to do with everything. Like one way is to deal with it is would be addiction to drugs and alcohol. And another way to deal with it would be to enjoy having time to do a walk or to
if you can, I think many artists have like a tragic life, because they work hard and they have no immediate success, and they get depressed, or they get hyperactive, and they exploit their body and their psyche also. And it's not quite clear, can you live a normal bourgeois life? Maybe Thomas Mann did that, these kind of authors. Can you live a bourgeois normal life, a regular life, and still be creative artist? Maybe some people manage to do that, but many need some, extraordinary effort to overcome everyday boredom and everyday being stuck in uncreative moments, So hard to say.
Yeah, true. I mean, I see the truth in that it's difficult to give general advice for everybody.
Yeah, right.
What for me personally is important is for me to know that even a lot of great artists were like struggling personalities. This is not mandatory in order to do great art.
No.
And that it's especially today, where we have so many resources for solutions, and people have access to so much knowledge and so many resources. It's possible to live an extraordinary life that's not bourgeois, and that's not like the standard 9-to-5 school studying kids career life, and still be healthy and happy and creative.
Yeah, possible. Yeah, possible, because we live in a particular situation here in the Western countries and cultures where we're basically rich compared with the rest of the world. And maybe, it could be that there is a way to be creative and still healthy. But, sometimes it's important to, if you get in contact with people which are creative workers, come to therapy, to kind of change their way of, not their way of life, but their way of, enjoying their work, or enjoying more their work. You have to kind of eliminate certain block, maybe they are blocked by certain internal demands, for instance, demands for supremacy, demands for narcissistic goals, demands for being criticized by your internal parent, which still, although died already, is in yourself, represented by an interact. So sometimes it's important to work with the people who want to be creative and live an enjoyable life, to eliminate these blockings, which prevent that they have that they can access the resources.
100%, yeah. I absolutely agree on this. It's also very close to my own experience. And for me, it was a big step to allow myself that my wish to do art and live a creative life is the best that I can do for myself, and it's really positive and great, and that I'm kind of okay, or not kind of, I'm completely okay now with being the only person in my family without a doctor degree, without following a very traditional career path.
Yeah.
And that I'm really happy about this now, and that it was not always like this, or it was something that I had to look on for myself and get clarity in.
True. You feel happy because you feel free, not to fulfill the scheme, the traditional way, which is common in your family. But the price is also unsafety. You don't know what happens.
Yeah, which I'm a big fan of nowadays.
Yeah, it's great. If you can enjoy the risk of having an unsafe future, because of its adventure, because it opens possibilities, it's great.
So something that I found for myself is the realization that today it's the best time and age to be an artist on the one side, and on the other side also build a business around this art.
Yeah.
For example, a business that's service based, and where you fulfill a demand and a need that is here right now.
Yeah, right.
For me, that's nowadays it's coaching and supporting other people in their creative paths and ways. And I'm starting my master degree in like psychology, and I'm doing my things to to create a life that rests on multiple so to speak,
to stand on more than one leg.
Yeah, exactly. And art is still a very, very big part, and something that I'm really interested and passionate about. And I think for me it just makes sense to have multiple legs. And
it's true. I found the same thing. I spent my life in the Caribbean in the wintertime for 2 months, and then I meet all these surfers, and these surfers are fanatic sportsmen, and they know that when they're 40 they don't have any more chance to be a trainer or a coach in surfing or kiting. But they all had, most of them had a little business on internet, like, property business, or law business, or coaching business. So in time, they prepared the way how to continue after the career as a shooting star on wakeboard or a wakeboard or something, or kiting, was to continue.
Yeah, I love that. That's so important. I just had to talk with a friend the other day, and we recorded like music for 2 days, and we talked about exactly this, that creating multiple legs so to speak.
Yeah.
Also important to be able to be independent in your art and to be able to do
Yeah.
and say
Right.
as an artist how and what and how you really want to do it, and not have to rely on
Mm-hmm.
a producer or a company or other sources of money that you can't control.
It's true. Yeah, that's wise. And maybe that's a different. Maybe it's a different generation. It's just a different generation which is more creative in the way of creating business. Besides being, free, have enough time and energy free for the art. Maybe
Yeah,
that's the modern way of surviving as an artist.
yeah, and maybe also realizing that creating a business and creating something that supports other people and helps other people is something that's extremely creative too.
True, also, yeah. Mm-hmm.
This leads me to another point I wanted to, or another question I wanted to ask you. When we spoke about business and creativity, I had to think about like Silicon Valley, and something that's very en vogue, so to speak, there at the moment is utilizing psychedelic substances
Mm-hmm.
for, at one hand, for enhanced creativity, and on the other hand, also for psychological healing, if I want to use that word.
Yeah.
So through microdosing and also through using plant medicine, as it's often being called in these circles.
Mm-hmm.
And I know that you also plan to do research around this, or already have done, that you already have done some research around it. What is your personal opinion in this field? Do you see this as a
Yeah.
possibility?
Yeah, actually, there are 2 points I think to make. One point is that traditionally, in most of the indigenous cultures, they have some psychedelic plant or experience on some ritual basis once a year or something, which obviously helps people since always, since ever, to for a certain time, certain night, certain day, certain week, leave the usual context of the living to kind of review and kind of reset and kind of remake the living. And until, the Western society came into contact with these psychoactive drugs, there was just alcohol, and heroin or opium. But then, when the research began to discover what is the chemical agent which makes it possible to use psychoactive drugs to change attitudes, life, behaviors, despair, for instance, depression, fear of dying, they found out that it's the same mechanism, or very similar, but much stronger, which we use in hypnosis. Because two things, again, also with psilocybin or with LSD or with mescaline, they all use the same mechanism, deactivating the critical agent in your brain, which rationalizes and uses reason to evaluate, and it also deactivates the ego part of the brain. And so you're in this loose state, kind of egoless, you're losing your ego for a moment, and then you overcome fears and you overcome, compulsions and obsessions and everything which kind of binds you and is in usual life. And the interesting part is that most of anxieties, obsessions, addiction, and depression has to do with your ego, because the thinking, your thinking is always, circulating around your ego. Can I do this? Am I perfect? Can I survive with the drug? Will I die or something? And it's all has to do with the ego. And if for a moment you can distance yourself and get more global perspective of being, then the ego isn't important so much, and you feel connected to something different. Maybe for some people it's God, for some people it's just the universe or the general consciousness, and then you see that you don't need those things, and you maybe can revise your life plan at that time. So the psychoactive drugs are like, as Aldous Huxley said, they open the doors of perception. You see things different. Maybe just for one night or 1 week or so, but then the door's open and you can re-enter and revise some of your conceptions.
Beautiful. And since ego is at the moment very much used term and often is not defined, could you define how you understand ego in a few words?
Yeah.
On the same page?
Ego is the consciousness of yourself. Ego is to be conscious of yourself. And it's loaded with all kinds of burdens, like how have I to be and what have I to do to be acceptable as a person, and how do other people see me, and can I be proud of myself, and did I things wrong, do I feel guilty or feel ashamed because I got the blame for something. So all these negative emotions has to do with ego, because the ego is kind of disturbed by that.
Mm-hmm.
And if you can let go with the ego, it doesn't matter anymore. Although it's just for a moment, while you're under the influence of the drug, that it's relative. That you can let go. And that's the effect of both hypnosis and the psychoactive drugs. But as I said, those psychoactive drugs are much stronger. The only disadvantage of the psychoactive drugs is if you just ingest them, you can stop them. Then you stay with ayahuasca for one night, and maybe you have not such a nice night because your stomach doesn't like it too much. While hypnosis, you can, stop anytime.
Yeah. True. So with both, it's about getting an outside view out of your usual ego perspective.
Right, yeah.
And maybe having such a different view on it that this ego also gets less and less important.
Yeah.
After this experience.
Yes. And also, besides of being less ego connected and ego driven, if you feel not your ego, you feel something different. You feel being in some consciousness, some world, which is bigger than you. And merely feeling this may free you from anxiety, because your ego is not in danger.
Yeah.
Because you don't feel it.
Yeah. And also because you realize that there's something that's bigger than this ego.
Yeah, you lose, in a way, you lose importance. This may be, you as a person lose importance, because there is something which is much more important and much more, will persist after and before you had persisted. So it becomes smaller, but also more contained, because you're part of it, this bigger being.
And I think this is very often called a mystical experience in literature, right?
Yeah, well, that's the extreme case that you feel just so loose from your everyday restrictions that you feel like overwhelmed and be close to God or close to the universe or close to nothing, and just being free of everything
Yeah.
and very happy in that way. I remember, I had two ayahuasca experiences. One was really hard on the body and the mind itself, but as well. But the other one was so smooth that it was well, organized. That for like, although my body was weak because the drug is very hard on your body, for 8 hours I was so free and happy. I didn't need anything, and I thought happiness doesn't need anything,
Mm.
and it's really happiness. Usually you think happiness is good if you have sex or if you have, a good car, a nice car, or, good meal or so. No, happiness may be something where you need nothing and just be.
Yeah.
But there's a danger, the danger is the microdosing. The microdosing is, then you say, okay, why can I have that every day? Because, you relapse normally, after having a good and fruitful uh, psychedelics experience, you usually have a relapse in everyday life and with the problem and the pain and the trouble.
Mm-hmm.
And then you may think, okay, let's microdose. I can take it every morning or once a week at least. But then it becomes a medication, and then it's close to an antidepressant or a
Yeah.
tranquilizer.
True. And I think I think the danger is that people, should I put this? The danger is that it prevents seeing that this, as you said, happiness is in us and that we don't need anything for it.
Mm.
And if we still think we need like microdosing for it, we still externalize it,
Yeah, right.
and we just progress from not believing that it's a car that we need for it, but now it's microdosing that we need.
Yeah, right. It's a substance, it's matter,
Yeah. So it's just
Mhm.
a new projection on something different.
Yeah. It may still be useful as a medication for addicts, for instance, drug addicts or depressant. But in usual life, you should be aware of you don't need anything, just you and yourself. And sometimes you have a bad day, a bad week,
Mm-hmm.
and then either you take it because life is always some drama. Life is not always happy, and life needs drama. And also, maybe you need drama to see what happiness is, and you just take it if it's not too strong. I didn't mention something which is important. I think we talked about hypnosis, and one part of hypnosis is self-hypnosis.
Mm-hmm.
And self-hypnosis is different because it's in the beginning it's difficult because um, you miss the guidance. If you have a hypnotist or a therapist on your side, you're more concentrated because there's somebody who is with you and will organize the thing, so you don't get distracted, and you can concentrate on your images and on your state and deepen the state. But there's one difference, or there's one exception. If you try to heal or to support healing of somatic problems like pain or like sleeplessness, or like you have a wound, for instance,
Mm-hmm.
um, and then you can use self-hypnosis with images which are physiologically correct, describing the healing process. Then you can use it and put it on an MP3. You can put it on an audio tape, and then you can hear it every night. And then you can um, help your pain, help your healing, and help your somatic problems. I remember I several times got wounds when I was far away from hospital or medical care, and I made a tape which which contained images how the skin would, would close, and how the immune system would fight the bacteria, and how everything was going right in a very clear physiological sense,
Mm-hmm.
in a very clear physiological sense. And it helped very much the healing process. Although there had been the necessity to have medical care for that, but there was no. And so all those things which are somatic problems, which maybe are, taken care of by the medical doctor, but it can still, help the healing process by those audio tapes. It's different you can use it for warts, for herpes, for, wounds, for sleeplessness, everything or pain, which comes every day. But if you use hypnosis for solving conflicts, for instance, or healing trauma, then you're kind of lost if you're just on yourself, because then you need a person who knows you will make it. You will find a way out of the problem, and can guide you. Yeah, exactly.
So what I understood is that you like to use hypnotic tapes, so to speak, with suggestions, for example, for like physical healing, or for better sleep.
Yeah, falling asleep also. Yeah. Mm-hmm.
And then you listen to these tapes when needed.
Yeah, on demand. Yeah, right. Yeah.
And do you do these tapes for yourself? By yourself?
Yeah, yes, that's what I meant. I mean, I had these wounds, and then I made me a tape, and I heard it every night.
Nice.
But also, all my patients got a lot of tapes. Almost every session I tape, and if possible, I send it to them on WhatsApp.
And then they can re-listen to it.
They re-listen to it in the night, and every time they need it.
And just let it sink in more.
Yeah, in your system.
And I can imagine that people also hear different things for themselves at different times when they listen to it.
True. Every time you hear it, it has maybe a different meaning. Mm-hmm. Or it has the same meaning reinforced by the repetition.
And are there any, so to speak, ready-made hypnosis tapes for like somatic things that you can recommend? Is there something like that?
Well,
give it a try. Or...
there are millions of tapes in the web, but usually I think it's more efficient if you tailor the tape to the person you're treating, and then you can also include things of their life, of their past, of their history, of their trauma, of their personal experience, and also some metaphors and images which are kind of fitting exactly what they are thinking, what they are rambling about. So it's more efficient, I guess, to make individualized tapes
that are like personalized to stories and things and characters and so on of a person.
Yeah. Mm-hmm.
Yes. And I think there are also like self-hypnosis techniques without tapes. Are you using those too?
Yeah. After a while, for instance, say if you have warts or if you have herpes or something, then you construct a tape with all the physiological images and the metaphors which are, adequate for that. And then you hear it 2 times, 3 times, 10 times, and then you know it by heart. And then you just tell it yourself.
That's nice too. Like giving the suggestions to yourself.
Yeah, auto suggestion.
For me, for example, what I like to do is to use like some easy self-hypnosis suggestions to bring me into an open space before I do visualizations.
Yeah. Mm-hmm.
because I experience for myself that then I'm more receptive to them and more, and when I do it after waking up or before going to sleep, new pictures are like coming up that I'm not, that come from a different
realm,
different level, different world.
Different level, yeah. True.
I like to do.
Sounds good, yeah.
Very explorative. Awesome. Yeah, just thought about our conversations, a conversation and the different points we touched on today, which were hypnosis and the use of stories and fairy tales and metaphors. We touched on how to define mental health. We talked about like special kind of struggles that artists can have in their lives, or that artists share in a way. And we talked about psychedelics and the use of psychedelics and the also abuse of psychedelics in terms of microdosing. And we talked about self-hypnosis techniques. Is there anything that comes to mind for you that's missing in our conversation, or that can complete it in a way?
No. When you're doing, one interesting question is, maybe if you do research, many people ask you, why do you research? And many people which are earnest say research is also fun because it's the game and you play. But I think the key question why doing research is that you keep on questioning and just go beyond the accustomed explanations, and it's a way out to expand your experience. So also research is kind of the thing where you leave behind the everyday reasoning, the everyday concepts, and that makes it curious and that makes it fun.
So again, it's about being open and also about staying connected to yourself in the face of uncertainty. And speaking of uncertainty, something that I saw differently this week for myself is that, again, it's the perspective that determines if we see something as uncertainty or novelty or excitement. And that we need, on the one hand, we need like security and safety in our lives, but also novelty and excitement, and find a balance in that.
Yeah, right. We need novelty also. Otherwise, it would be boring and would be going in circle. True.
Nice. And maybe as a last question, or something that I want to pick up again from our conversation, is kind of at the beginning, you, as far as I remember it, you said something like that in therapy it's also about helping the client to rewrite their own story, or to rewrite this own novel, and to find, and I think like finding these new perspectives is part of that, to rewrite it in a way, to rewrite the story.
True.
Agree on that?
Yeah, agree, totally.
And that hypnosis and psychedelics can be a way to
open the mind
in a more fun way.
Yeah, in a more fun way and more potent way to open your mind and be able to change things.
Yeah.
Not get connected and stuck to the old-fashioned way of thinking.
I like that. And I think you also said that not everybody can go into a hypnotic state or can use hypnosis in order to get to a trance state. Is it something that can be developed over time, that people can learn?
Well, some have have a hard time to get into a trance, maybe 15%. And some don't get into trance in the first 10 sessions, maybe, but then more and more, if they trust in the method and they see the effects, they easily can let go. And there's something to do with control. And, you know, people who need control have difficulty to go into a trance, but they can, you know, let go from control if they trust. And so it's a matter of, you know, developing. You're right.
So it's about developing trust into the method, probably also into the therapist.
And yourself, yeah.
At the end.
Mm-hmm.
And learning that it's fun to let go in the right moment.
Yeah.
Okay, that's beautiful. And I think that's also, if somebody listens or to this or watches this and doesn't have any experience with hypnosis,
Yeah.
Great. It's great to know that this can be learned and
Yeah,
that
sure.
can be very. And if somebody wants to give hypnosis a try, so to speak, to experience that for themselves, do you have any advice how they can do that?
Yeah, right. It's good you mentioned that. You know, there are many hypnotists, and many hypnotists are lay hypnotists, and they do not really handle the method in a clinically all right way. And so, but there are, you know, societies, professional societies who deal with hypnosis and who have lists of psychotherapists who have learned hypnosis, and they know how to handle it even in critical situations where, you know, traumas are reactivated or psychosis is kind of deactivated. And so on. There are 2 or 3 societies in Germany where you can mention them in your video, which have lists of therapists you can apply to.
Okay. So it's like an index of therapists, and people can find the therapist there. And I think for people who are not in Germany, from another conversation we once had, I remember that one tip of yours was to seek out people who are mental health professionals,
Right,
being psychologists or therapists, and work with hypnosis in their praxis.
True. Yeah, exactly.
Awesome.
Okay.
Cool. Yeah, thank you very much, Dirk, for this interview. And if people are curious about what you do and want to connect with you, what's the best way to get more into your world, so to speak?
Well, they can Google my name and then they find my homepage. And they see movies and videos and books and articles and therapy.
Beautiful. I will also link to this webpage in the show notes and in the video description, so people have an easy way finding you. And yeah, to the listeners, we see and or hear us in the next episode of this series. Have a good